Hey guys, Dr. Will here from Miami Spine and Performance. We're here with one of my patients, Jimmy. Jimmy spends a lot of time working in front of the computer, working on the screen. He has a TikTok channel that's what he does professionally. And so as you can imagine, since he's in front of the screen and in front of the computer a lot, that leads to some issues with posture and it causes some tightness in his upper back and neck. So that was the reason why Jimmy initially came to me. So what we've been doing is we've been working together to make sure that his spine is moving well. We've tried to release some of these muscles that have gotten tight over time just from him working in front of the computer. And now we've kind of been focusing a lot on strengthening his body, strengthening his upper back, and he's had a lot of success with that approach. So we're going to show you guys what kind of a typical visit with Jimmy looks like. So we're going to take you through all three of those phases. As you guys know, that's kind of the treatment approach that I take. We kind of address the joints, we address the muscles, and then we address the rehabilitation component. So first thing I'm going to do is check Jimmy's back today, see how he's doing, and then we'll get into the adjusting. Just go ahead and sit up straight for me. So like I said, guys, for those of you, whether you're a student or whether you're working at a computer, this area tends to really get jammed up because we get that sort of forward head position and we're kind of hunched over a little bit working on what we're doing. So this is usually an area we're working on with him. We're usually also addressing both of these SI joints that kind of get a little bit jammed up from sitting and working. And of course, we get some issues up here in the top of the neck as well. So usually he gets some tightness up through here. All right, Jimmy, go ahead and lie face up for me. Slide this into your feet. And cross your arms for me. Gotcha. Let's go this way. Jimmy's also an avid concert goer. He's been to many concerts this summer.
I don't think I can count.
Scoot towards me just a little bit. Okay, so we're going to get that upper to mid back here. Just let everything go. Nice. On your right side for me. So if Jimmy were to just come in and I were to spend 15 seconds with him, that's what I would do, because I think that's what has the biggest effect is adjusting that upper back area, and that's where he usually by the time he comes in at this point, I'm seeing him once a week or so. By the time he comes in, he kind of feels as though he needs to get some movement in that area. So cross the arms here. And again, sitting can kind of take a toll on the pelvis and those SI joints. So usually he's a little bit twisted down there. So that's something else that we address when he comes in. Oh, good. Other side. Let's go here. Good. Go face up for me. You have a history of some ankle sprains?
Yeah.
Yeah. So
both ankles.
He's had some chronic ankle sprains. He used to play soccer actually, and so
Snowboarding too.
Snowboarding. And so what happens then is, since his ankles are not as mobile as they should be, there's a little bit of scar tissue in here that causes some tension to build up in his midfoot. So even though he's primarily coming in for upper back and neck pain, we're also addressing this as well, right? Because the whole body kind of works together. So we want to make sure that everything's optimized. So just let everything go here. And we're just making sure that he can push off this part of the foot really nicely. Ooh, good. Same thing here. So we're a little bit higher this time. Just gonna bring the elbows in and pull. You know, adjusting the feet is always, it's like just as satisfying for me as the patient. So
yeah,
feels great. I wish I could get my feet adjusted like that. Today with Jimmy, we're going to do an adjustment for the neck, and we're also going to do his favorite part of coming in, other than seeing me, which is the Y strap, and get some decompression. Have you been able to rig one up at home yet?
No.
He's been trying to rig up like a homemade decompression device, to which I've cautioned him and not recommended to do so. If you're listening, malpractice. I didn't tell him to do that. Slide up towards me. Keep going. Yeah, that's good. So usually what causes the tension up here is just sort of that forward head position, right? So he's usually showing things in front of the camera and he's got people watching him. He's engaged with an audience online. So I'm sure the head can end up forward and that ends up with these areas being kind of tight. So we're going to go right there and right there. Just let everything go. Good. Same thing here. All go. I got you. Yep.
That was
Okay.
it.
Slide down a little bit for me. Maybe slide down just a hair more.
I feel like I grow an inch every time we use this.
Yeah. Lift your head up for me. Good. Side effects may include height increase. So really what we're trying to do here is we're just trying to decompress the spine, right? And the good thing is we can kind of anchor up top, and this is actually decompressing him. Mostly he's going to feel the neck and the upper back, but we're actually getting decompression all the way down to the tailbone. So I'll usually put some pressure on, put some pressure off, just like this. At the end, we'll give like a little pull, just to see if there's anything else to release in there. And this type of treatment is totally safe when done by a trained professional. I wouldn't recommend that you try to do this to your friends or do it at home. As much as everyone's craving decompression, just go see a chiropractor in your area. A lot of us are trained to do this type of thing, and it's all safe as long as it's in the hand of a professional. So, all right, just let everything go. Just like that. So we give a little pull, a little decompression. Jimmy's a happy camper.
Yes, my favorite part.
And that's it, guys. You can go ahead and sit up for me, Jimmy.
Feels so good.
So what we're going to do next, now that all of his joints are moving good, he's nice and decompressed, is we're going to make sure that all these muscles are taken care of. So I'm going to show you guys some active release technique, some of the things that I do with him, and then in the third part, I'm going to show you how we strengthen his shoulders to build some long-term durability. So thank you guys for watching. Don't forget to like, comment, and subscribe.